So I'm going to be talking about psychological sort of aspects of coping with chronic disease or chronic pain. So you've had my introduction already. I currently run a virtual health psychology clinic that focuses on treatment of chronic disease. These are my speaker disclosures, and none of them have influenced this presentation. So I think it can be helpful for us to understand how our brains react to stress and how they function. So part of our brain, I just refer to it as our survival brain or our caveman brain. This part of our brain is responsible for things like emotions, automatic thoughts, learning, memory, appetite regulation, and pain. And it's built for survival. So it gives you fantastic advice if you're a cave person and your life expectancy is 30. And the kinds of threats that you deal with are bear attacks. It also functions automatically and unconsciously. So you cannot turn it on and you can't turn it off. If you put your hand on a hot stove, you'll pull your hand away before you consciously register pain. And that's this system in action. It's really helpful to keep in mind that this is where pain signals come from. And from a survival mind perspective, pain usually signaled something that was life-threatening. And it was probably a wise idea to stop, movement, to hide, to, take care of yourself until that sort of pain, acute illness or injury went away. And this is, in fact, fantastic advice for acute illness and injury. If you break your leg and it hurts to walk on it, keeping it still will allow the bone to heal itself. That's what the casts do, right? And so we end up with these signals from our survival brain when there is pain to suggest you need to stop, don't move, right? And so it's very understandable that that's how we respond to chronic pain. We don't have a system like that developed for chronic pain. And so we have this urge to stop moving, and that's signals from this survival mind. Of course, we know in chronic pain that makes things worse because you end up with other muscles that aren't moving enough, and you get into a vicious cycle about additional pain. But it's really normal and understandable that we have this urge to stop moving. The other relevant part of our brain is our prefrontal cortex or our frontal lobe. And this part of our brain controls executive functioning. This is things like starting behavior, stopping behavior, planning, decision making. It's where self-control comes from. This is where willpower comes from. And unlike our survival brain that's always working, our frontal lobe is like a battery. And so we'll wear out that battery of self-control as we use it up during the day. And that's why things like binge eating are more likely to happen in the evenings compared to the mornings, because we've used up that battery of self-control. But our survival brain is still there, happy to offer you something that's going to make you feel better, at least in the short run. So I also just want to remind everybody that in terms of the impact of the pandemic on all of us is that our survival brains are on fire and our frontal lobe batteries are incredibly spent. So again, survival brains detect threat and they do their thing. You don't have to be consciously aware of the threat for this system to activate. There's a whole cascade of hormones and neurotransmitters that impacts, that gets activated unconsciously and automatically by this system. As well, our frontal lobe batteries are spent. It takes way more effort to get through a COVID day than a non-COVID day. And there's all kinds of behavioral changes that we have to do that are constantly changing. Most of us hopes, right, that vaccines would be our quick ticket out of the pandemic. And of course it's not. And so we're thrown back into uncertainty. And this is something that survival brains hate. They hate uncertainty. And so it's also to keep in mind that if you have chronic pain, it's also like having a survival brain on fire. It is constantly worried that there is something life-threatening happening to you because there are pain signals, and it's trying very desperately to try and get you to, rest so that you can heal, so that you will survive. Again, that's not what's the best idea for chronic pain, but this is an automatic system that is well designed for a different time, and it's just a mismatch with the kinds of things that we encounter in our modern world. And so I also want to remind people that stress impairs things like concentration, memory, attention, problem solving, and decision making. And so pandemic brain is a real thing. This is also the exact same thing that happens if you're in chronic pain. Because that caveman brain or survival brain is on fire, it is using up resources. It's using up part of your frontal lobe. And so in the pandemic, if people are noticing forgetting things, it's harder to pay attention, it's harder to get things done. This is the impact of stress on the brain. And it's not because you're not trying hard enough. This is just what happens to brains under stress. So in terms of things that we can do to cope with both the pandemic and a chronic disease, the first tip is about charge your frontal lobe, right? We can't do much about the stress sometimes. And so if you can do something about the stress, do that. But for many of us, there's a lot of uncontrollable stress to charge our frontal lobe. And recharging activity is something that makes you feel more energetic at the end than when you start. So common ones for most people would be things like sleep, eating healthy foods, staying hydrated, physical activity, being in nature, and social connection. But there's also individual differences. So for an extrovert, being with other people is going to be recharging. For an introvert, that might be draining. There's probably also an optimal amount. Going for a walk for 30 minutes might be recharging. Going for 6 hours might be draining. This isn't the same thing as a healthy habit. If going for a walk makes you feel angry and irritated, then it's not a recharging activity, even if it's a healthy habit. We're actually looking for things that make you smile, things that make you feel a bit lighter, things that give you a bit more energy. And to be paying attention to what those might be in our day. It's much harder to do either if you have a chronic disease or in the pandemic because we're cut off from things that may have been recharging activities in the past. So the tip number 2 is that sometimes we act like that frontal lobe battery is unlimited and that if you just put more effort into it, you can achieve more. But that's not true. There is a limited amount of battery and all of us have a limited amount of battery. And so one, we want to be intentional about charging our battery. We often have to be more intentional about this, both in the pandemic or if you have a chronic disease. And also, what are you spending your battery on, right? If you have a chronic disease or chronic pain, it means that some of your battery is going to deal with this chronic disease or a chronic pain. Some of it gets allocated towards that. And so you have less frontal lobe battery available to you to do other things. And so if you have less battery, what are you going to spend it on? And there's some things that anybody could do, and there's some things that only you could do. Can you save your battery for the things that are most important? I completely understand that there are things like laundry and dishes that absolutely have to get done, but it kills me a little when people use their battery to do laundry instead of spending it with their family or friends. Again, not everyone has other options for how to deal with that, but to consider, what are things that other people could help me do versus things that only I can do. And it also can help us keep in mind whether an activity is kind of short-term relief or recharging, because our caveman brain or survival brain loves short-term fixes. And there's lots of things in our world that are short-term relief, things like food, for example, sugary, salty, fatty foods, but they might not be recharging. So many a night in the pandemic, I've had ice cream for dinner and I feel great at the beginning, but I do not feel recharged at the end. And so that's really a short-term relief offered by my survival brain in a very normal way, but not really recharging. Pacing is also one of the key skills that we are trying to teach people with chronic disease or chronic pain. And what happens for most, this is a really normal human response, which is that everybody has good days and bad days. And what happens when you have chronic pain or chronic disease is that when you have a good day, you kind of think, oh, I don't know when the next good day is going to be, so I better get everything done. Who knows when my next good day might be? And so people tend to overdo it. They get as much done as possible, and then they kind of pay for it. And so then they have a bad day. And so then on the bad day, they can't do anything. They have to rest. And then it, gets a bit better, and they think, oh, I'm kind of having a good day. I better do everything because I just spent several days in bed. I couldn't do anything. So now I got to get everything done. And we end up on this boom and bust cycle. And over time, that sort of decreases the amount that we can do over time. Pacing is about keeping the activity level the same, regardless of whether it's a good day or a bad day. So it's a really normal human thing to wake up and to think, how am I feeling? What's my pain level at? What can I get done today? But if you have a set level of activity that you do on either a good day or a bad day, it actually makes us feel more in control because we're doing the things that we want to do regardless of our pain. And the hardest part about pacing is actually holding back on a good day. Many people will push themselves on a bad day, but holding back on a good day when you have energy and to stop yourself, that's actually the trickiest part of pacing. So another thing that's really helpful to cope with chronic disease or chronic pain is a term we call psychological flexibility. And this is our ability to do different things depending on the context. We often need to have a lot of different coping strategies to adapt well in life. And for many of us, there's two main forms of coping. One's called problem-focused coping. And in problem-focused coping, it's when there's a problem that can be fixed. You can make the problem go away. And so for these solvable problems, these are things like you work on the task, time management, these sorts of things. Most of us can rely on problem-focused coping to do many, many things in our lives. Many of our jobs rely on problem-focused coping. There's an email you have to send, there's a report you have to write, papers that need photocopying. Those are all problems that can be solved. You can work on them and they go away. Of course, there's the next thing in your inbox, right? But problem-focused coping, many of us can use this to be very successful in life. The other form of coping is called emotion-focused coping. And this is for problems that can't be fixed. It's for problems where there is no solution. There's no way of getting rid of the problem. And then what we're trying to do is to deal with the emotions from an unfixable problem. And for people, if you have a chronic disease or chronic pain, it is by definition unfixable. It is not something that you can make go away. And so we need this other set of coping skills to be able to manage this unsolvable problem. And many people have never needed these skills up till this point in their lives. And so on average, we tend to need help with the emotion-focused coping skills. Now, if somebody's using only emotion-focused coping skills and no problem-focused skills, then we focus on that because, again, our goal is psychological flexibility, that you can do both because both are necessary. But on average, there's more people who need help developing the emotion-focused coping skills. And again, that doesn't mean you replace the problem-focused skills, it's that we're adding to our skill set. And this tends to be the skills that we work on for people with chronic disease or chronic pain. And another way we can think about this is understanding the emotions that arise because of having chronic pain or a chronic disease. Many people will screen for things like depression or anxiety. And of course, we know there are higher rates of these disorders, of kind of psychiatric disorders in populations of people who have a chronic disease. But there's another group which we refer to as chronic disease distress. And this is a much higher group of people, percentage of people who will have this in chronic disease. Chronic disease distress is the distress associated with having a chronic disease, and it includes symptoms of depression and anxiety and irritability. But it's about the chronic disease. If somehow you could remove the chronic disease, they probably wouldn't have those symptoms. Chronic diseases impact people enormously in their lives, and you never get a vacation from them. And so it is normal to have an emotional response to that. And so it's important to distinguish between major depressive disorder and chronic disease distress, because chronic disease distress takes into account the fact that this person has a chronic disease. And so there's a scale, that we've developed in our research that was built off of the diabetes distress scale. And this scale involves these subscales, which is that there's an emotional burden of the disease. There's a regimen distress, meaning people have to spend time and energy and frontal lobe battery on activities that to manage their chronic disease or chronic pain. There can be patient-provider distress if you feel disconnected or not understood by your provider. And then social support distress, that people in your life might not understand when you can't do activities or you have to cancel. And so there's distress in your interpersonal relationships. And what's important about acknowledging chronic disease distress is that you would treat it differently. The treatments for chronic disease distress have to take into account that there is this unsolvable stressor that will go on versus treatments for major depressive disorder or an anxiety disorder are not designed to take those factors into account. And so many people can feel that those types of interventions may not serve them as well. There definitely is higher rates of major depressive disorder and anxiety disorders in chronic pain populations, but a much larger percentage is going to have this chronic disease distress. So the tip number 4 is about build a village, because I like to say it takes a village to be well. And so if you live in a small town, then you know the benefits of being in a small town. Of course, there's some drawbacks as well, but there's many benefits of being in a small town. If you don't live in a small town, and many of us now live in urban areas, then we actually have to build a village. We have to create a modern day village. And a modern day village is going to look different than a traditional village. So first, a modern day village is always going to be more than your biological relatives. Technically, if your whole village was biological relatives, that would result in inbreeding, and that's not great. So we want to think about the fact that we're actually meant to invite people to be part of our village. It's supposed to be more than your biological relatives. We probably need to rely on technology even in non-pandemic times, because we won't physically live close enough to other people. Now, there's lots of data suggesting that social media is not, in fact, a great way to stay connected to people, but things like messaging or texting, video chats, those things can help us stay connected to our village, both in pandemic times, but also in non-pandemic times. There'll be different parts of your village that might never meet each other, but serve different parts of us. So during wave 1 and wave 2 of the pandemic, I was still a frontline provider at the hospital, and it was really helpful to have connections with other healthcare providers, because we were experiencing the pandemic differently than people who weren't in the healthcare system. And so it helped to validate my experience of what was happening. It's also really helpful to have connections with parents who understood what it was like to have children at home when schools were closed. And so we often will have these different parts of our village that might never meet each other, but are serving different parts. Our healthcare providers are probably part of our village. And so family doctor, specialist, a psychologist, a massage therapist, they are also people helping us be well, and they, are part of, count towards our village. And then finally, if you have the means available, sometimes we need to pay people to be part of our village, and that's okay. I'm a single mom 50% of the time, so sometimes I have to pay a babysitter to be part of my village. If I lived in a small town or close enough to other people, maybe my kid could just go over and hang out at other people's houses, but I don't. And so I have to pay someone to be part of my village, and that's okay. Again, what can anyone do versus what can only you do? And again, this is not available to all people, right? Many people do not have this at their disposal. But if you do, you might want to think about, how can I free up some frontal lobe battery by allowing somebody else to do something that doesn't require me to do. And so it's important to kind of have this village to be well. And there's lots of data showing the benefits of having, a village, safe, trusting relationships. They have some studies where they have people stand at the bottom of a hill and estimate how tall the hill is. And if you're standing there by yourself, you actually estimate the height of the hill as being higher than if you're there by yourself. Then they have ones where they have people wear a backpack. And even though they're not going to help you, if you're there with loved ones, you actually estimate the weight of the backpack as being less than if you're there by yourself. Then they have some studies where they have people in a functional MRI machine, and they give a standardized shock to their toes. And so you can see the pain receptors of the brain light up. And if you're holding the hand of a loved one, your pain receptors literally do not light up as much as if you're there by yourself. Now, if you're holding the hand of someone you have a distressed relationship with, it's actually worse than being there by yourself. So this is not about the benefit of be with somebody no matter what. This is about the benefit of safe, trusting relationships. But when we have those relationships, the obstacles don't seem as big, the burdens don't seem as heavy, and the pain doesn't seem as bad. That's not because we fundamentally changed anything. It's just that we're hardwired to feel better when we feel connections and in a safe, trusting village. I'll also, repeat the message from the last presentation about the fact that, is it all in my head? Everything is all in your head. You cannot see anything, you can't hear anything, you can't taste anything until it is processed by your brain. We actually see the world upside down, and our brains rotate it back so that we can see it in a certain way. And so, yes, pain is in your head, but that doesn't mean it's not real, because all things need to be processed through your brain. And of course, this distinction we have between physical and psychological is really not a real thing either, because we know that they influence each other across the board in all kinds of conditions. So sometimes it's not about being more resilient. Sometimes it's about falling apart more effectively. If you have a chronic disease or chronic pain, you absolutely need a village. Um, and this is also true about the pandemic. Life is hard in the pandemic. And so this quote says, "I'm afraid," said Rabbit. "What are you afraid of?" asked Bear. "I don't know," replied Rabbit. "I just am." "Then I will sit with you until you're not afraid anymore," said Bear. "We will face it together." And so you want to have that village of support, because nobody should be trying to live in the pandemic by yourself. Again, there's all kinds of restrictions that have changed the way we have to connect with our village. And if you have a chronic disease, a key skill is learning how to ask for and accept help, because it really, you absolutely need a village to be well. So just in terms of some additional resources, these are some evidence-based books that you can apply to chronic disease or chronic pain. So again, we actually know a lot about treating chronic pain from a psychological perspective, and there's lots of evidence-based resources that you can that are available to deal with that. This is, of course, I guess full disclosure, my book about healthy habits suck, which is about kind of engaging in healthy habits, which often there's a longer list of things you have to do if you have a chronic disease. Finally, just resources from my clinic. So the values of our clinic, my clinic is about trying to reduce human suffering, to bring people together and increase access to science-based information. So all of the treatments that we do are evidence-based. They're from the literature. We know that they work. It's available to residents of Atlantic Canada, BC, Alberta, Ontario, and Quebec. And we do group-based clinical interventions on health-related topics. There is a fee, unfortunately, for them. It's not part of the public system, but it may be covered by extended benefits or insurance if you have it. We have a program, a group program starting October 27th on healthy habits, and we have one on chronic pain starting in January 2022. So we run them as groups, one, because we know that there's additional benefits from the social support from groups, and two, it increases access to care, both because of the number of people who need services that often can't access them, and also it's less expensive per person. So instead of $225 an hour, it becomes $67 an hour, and so we can help more people in that way.